My name is Barbara Thompson. I'm a professor in the occupational therapy program at the Sage Colleges, and I'd like to welcome you to the second Scleroderma Interprofessional Education event. This is sponsored by the Sage Colleges of Health Sciences, the Albany College of Pharmacy and Health Sciences, the Steffens Scleroderma Research Foundation, and the Steffens Scleroderma Clinic at the Center for Rheumatology. And I would like to take a couple of moments to acknowledge the special event we have in the back. The nutrition department has sponsored this, and I'm going to have Christy say a little bit about it.
Hello, my name is Christy Cargill, and I am a dietetic intern at the Sage Colleges. I am doing a rotation in food service management, and this the food that is here tonight is part of my theme meal project, one of my big projects for the semester. And I selected the food to accommodate patients that have scleroderma. So I selected foods that are going to help with the GI symptoms mostly, specifically like low lactose and low FODMAP foods. And that's it. I hope you'll, survey. I have a survey that I would love for you to fill out. I'm going to try to bring them to the tables, but you can bring them back to the back before you leave. That would really help me out, and I hope you enjoy.
And I just want to also give a special acknowledgement to the patients and families who are here on the periphery of the program, who are joining us. You will be meeting them at your tables later in the evening. Thank you very much for coming out. I know that some of you have traveled from quite a distance. The program wouldn't be the program it's going to be without your presence, and we're deeply appreciative of your being here. I will give a very brief overview of the program, but first I'd like to introduce Peter Mienen, who is a board member on the Research Foundation, Scleroderma Research Foundation, have him give us a few opening remarks. And I would also say that he has quite an illustrious educational background, which he's a little bit shy about, but I do want to acknowledge that. He has a PhD and has a very strong background and is a very active board member.
As Barbara mentioned, I am a member of the board of directors of the Steffens Scleroderma Research Foundation, which is actually located in the Capital District. And I'm also joined here tonight by my better half, Linda, who is in the back at the table back there, and she's vice president of the foundation, so she should probably be talking instead of me. As a foundation, we have three primary goals: to promote research towards the treatment and cure of scleroderma, Dagos, and other related rare diseases, to promote awareness and understanding of these disorders, especially, I think this relates to tonight, especially among healthcare professionals, and also to encourage collaboration, both nationally and internationally, to achieve these goals. Our foundation recognizes the importance of interprofessional education and the necessity of cross-disciplinary teams for the early recognition and the ongoing treatment of scleroderma patients. I can't emphasize enough that quicker diagnosis is especially critical for the treatment of rare diseases such as scleroderma. Now, let's get a little personal here now. From my own personal research experience, I was a researcher at GE's Global Research Center here in Niskayuna for many years. And I can't emphasize enough the importance of cross-disciplinary teams to come up with the best solutions. As an example of this, the creation of GE's first CT, computerized tomography, and MRI, magnetic resonance imaging scanners, occurred locally at the research center here. And it involved many different disciplines, such as electrical engineering, mathematicians, physicists, mechanical engineers, chemists, computer scientists, and physicians. Tonight, we have students in occupational therapy, nutrition, nursing, pharmacy, physical therapy, psychology. We have scleroderma patients, and we have an expert panel. This, in my opinion, is simply fantastic. We are filming the event tonight to share best practices in IPE and awareness with other scleroderma organizations. I want to thank the Gilead Corporation, who has a table back here, for helping sponsor this event, and in particular in being active in healthcare professional education with respect to scleroderma in the capital region. The Steffens Foundation extends our gratitude to all the organizations and professionals, patients, and students involved in the planning, execution, and making this event a reality. I want to thank you very much.
I'd like to introduce Amy Guyson.
For those of you who are unfamiliar with it, scleroderma is an autoimmune disease that causes an overproduction of collagen in the body, which in turn causes stiffness and hardness of the skin, joints, blood vessels, and in some cases, internal organs such as the lungs, heart, kidney, esophagus. Scleroderma is chronic, it's rare, and it has no cure. There are estimated to be about 300,000 people living with scleroderma in the United States currently. Scleroderma is a disease that tends to affect more women than men, statistically, but it is also seen in small children and young adults and teens. I know this disease inside and out. I know its symptoms and how it affects your body, your emotions, your life as a whole, and the casualties it leaves behind in its wake. I've had to watch countless close friends battle this disease, and most lose that fight. I know scleroderma so well because I've been living with it for the past 17 plus years now. Being diagnosed with scleroderma, honestly, is quite overwhelming. I had to be conscious of what I eat, where I go, what I wear, what the weather is like, how long I'll be sitting or standing, lying down, or even walking. There are so many variables in my life that I have had to adjust or change completely to accommodate this disease. It's as if this disease has packed its belongings and decided it wanted to move in with me completely uninvited. My life now is made up of routines. How I get dressed, when I take my medications, and how exactly I take them, to even how I shower and which parts of my body I dry off first. It's become a delicately choreographed dance to which I have learned and perfected over the last 17 years. Living as a person with a rare chronic illness has forced me to reevaluate my life, my goals, my friendships, my health, and how I live day to day. Now, normally, it wouldn't necessarily be a bad thing to get your life in order and become more responsible. But if you toss on a chronic illness that has no cure, that kind of changes the things a little bit. I needed to prioritize what was important to me as opposed to what needed to take a back seat in my life. My number one priority needed to be my health. So that's exactly what I did. I made a list of which doctors and specialists I needed to see and made appointments with the best doctors I could find near me that treated patients with scleroderma. That was a feat in itself. Back then, there were maybe 2 doctors locally in my area that had ever heard of scleroderma. So I ended up looking into hospitals that were out of town for treatment. Going to the doctor's office as a chronically ill person is a must and a common rule of survival. Scleroderma is a disease that is constantly changing inside your body and affecting different areas of your body and how those areas function as a whole. I learned right away that with the number of doctors that I needed to see regularly, that picking random doctors scattered all over the United States really wasn't going to work for me. I needed a team. I needed a group of specific specialists that could treat me individually but also be willing and able to collaborate and cohesively come together as a united front to make the best decisions for my health. It took me 5 years to find my team. And I have been with them ever since. If it wasn't for their coordinated care in regards to my scleroderma and their willingness to work together and to bounce ideas off of one another, I would not be here tonight speaking to all of you. That's why tonight is such an important event for the disease scleroderma and for the patients. All of you sitting here tonight are the future of healthcare. I would say that 7 out of my 12 specialists that I see on a regular basis for scleroderma are probably over the age of 50. What happens when these doctors decide to retire? Who will I go to that is willing to work with my other doctors as a team? Who will even know what scleroderma is? And even more importantly, how to treat it. That's why it is imperative to provide education and awareness for this disease, as well as many other autoimmune diseases out there. It's so important that we have medical professionals like all of you who are ready and willing to learn. The more familiarized not only specialists but all healthcare providers are with scleroderma, the better patient care will be. The easier it will be for patients to find care and proper treatment. I cannot tell you how many specialists I have seen over the last 17 years who had no idea what scleroderma even was. They had never even heard of it. That is definitely not someone I would put my trust in to give me the best care or the best treatment, period. That is why events like tonight are so important and need to be happening all over the globe. Interprofessional education events help to shed light on rare diseases like scleroderma. They promote not only educating, but also awareness and understanding of the disease. If it wasn't for events like tonight, this rare disease might not have ever been introduced to any of you. My hope for the future is to look back on this event tonight and be able to say that this was the starting point. This was the event that started many other events in the future, not only here at Sage College, but nationally and fingers crossed internationally. The lives of people like me and people with other autoimmune diseases out there depend on it. Thank you.
Thank you, Amy. I'm always unlucky enough to follow Amy because she's amazing. So thank you. Thank you so much for sharing. Hi, I'm Heather Friends. I am the Director of Simulated Patient Education at Albany Medical College, and this is my second year being part of this event, and I'm really happy to be here tonight. Not only am I very interested in communication, I'm also a scleroderma patient, which is how I was initially sort of spoken to about this event, and then came up with some ideas of other ways to use what I do for a living every day, which is simulated patient education. So one of the things that I want to say first is I used to go to conferences year after year after year, and they would all talk about interprofessional education, and they would say, but how do you do it? How do you pull it together? It's so hard logistically. It's so hard logistically. So just the fact that you're all in this room together is amazing and is wonderful, wonderful work for all the people who got you here. Interprofessional education is hard to do, and that's why it's so often overlooked. So give a big thank you to your educators who got you here today, and learn from one another to the best of your ability. Thanks. So I'm going to talk a little bit about questioning skills and what I think is important when it comes to talking with patients and talking amongst one another as a team. The first thing that's really important is to always make sure that you're really getting your patient's story, right? And that's not always easy. Patients come in with a story, but it's not always the whole picture. It's what they're seeing as symptoms. I think especially those of us who have scleroderma, sometimes we're having things go on in our lives and we're like, is this scleroderma? Does this have to do with this? So really making sure that you're, first of all, asking your patient a lot of open-ended questions. Tell me what's been going on. What other symptoms have you been experiencing? Tell me more about that. But then don't be afraid to follow up on that information that they give you, okay? Very often our patients give us what I like to call clinical cues, and we overlook them because we're ready with our next question, right? We're like, oh, I know what I have to ask next. I know what I have to ask next, and we forget to listen. Okay, so really make sure that you listen to your patient, hear what they're saying, and then follow up appropriately on that. I think it's always important to find out from all your patients how their problem, disease is impacting their life. But as Amy pointed out, she has to accommodate. She has to make accommodations. People with scleroderma have to make many, many accommodations to deal with their symptoms. And that's why we had a special meal made for us tonight. That's why this room is nice and warm, so none of us I'm not talking with white hands, which I am so often doing when I'm presenting. So really think about how does this impact your life, and then follow up on that. And develop your treatment plan to help with that impact on life. Okay, because that can make a huge, huge difference for your patients. I do have notes, so I'm going to take a quick peek and make sure I don't miss anything. Oh, I know what else is important, is to find out about patients' contextual features, right? So really find out, we talk a lot about, be sure you take a social history. But I like to really consider that more as contextual features. So I live in the cold weather, so how hard is it for me in the winter time, right? How hard is it for Amy in the winter time? Does she have someone who can help her with meal preparation? Those types of things are really important in scleroderma. So don't get so caught up in the medicine that you don't figure out the person and what surrounds them in their illness and their processes, right? And that starts with finding out that impact on life. And elicit your patient's perspective, not only on how they've been doing, not only on what changes might be beneficial to them, but when you give them a treatment plan, make sure that that's going to work for them, right? Make sure they can get to all of those appointments. You see how many? 12 specialists? Yeah, that's a lot of appointments, give or take. So making sure that you really elicit your patient's perspective as you go along. And finally, it's about collaboration, right? And that's what we're here to talk about tonight. So when it comes to collaboration, one of the things I want you to be thinking about tonight when you're sitting in these wonderful groups of all these different disciplines is eliciting one another's perspective. I can guarantee that you know different things. Think about your role when you're talking about your collaboration tonight. Talk to each other about how can the pharmacist help the nutritionist, help the nursing student, all of you. How can you come together to support your patients in a way that is collaborative? Elicit one another's perspective and expertise. That's really important. I think it's important that we always make sure that we're communicating with our team in a respectful manner and that we're sharing information. Imagine a patient with 12 specialists. Think about how important it's going to be to make sure that you document your visit well so that your next provider that's seeing it is getting that information. So that's one of the things I would like you to talk about when you're setting up your questions is how would we relay this information to one another? How would we relay what we found out from the other provider to our patient when we started to move forward with a new treatment plan? So those are some of the things I'd like you to think about when you're developing your questions. I may be able to come around. I can't think of anything else that you would want me to cover. Can you?
I think that's perfect.
Great, thank you so much.
Yes, thank you very much.
My pleasure.
Yeah.